Hello everyone, you're welcome to Mom Health Parenting YouTube channel, and I am Dr. Aderemi from Mom Health Limited. Today we're going to be talking about something really common when we are pregnant. We're going to be talking about swollen feet in pregnancy and how to deal with it. First of all, swollen feet is very normal. We know this. When we see ourselves, when pregnant women meet in antenatal clinic, you start checking out each other's feet, and we see that the feet are swollen. It's really normal. Why does this occur? Pregnancy causes a buildup of fluid. There's increase in the total body fluid, and so you even notice not only your feet. Sometimes women have their faces swell, their hands swell, in fact, general body swelling. It's totally normal in pregnancy because of the increase in body fluid. Another thing is your baby is growing, your miracle is forming, your uterus is getting bigger, and we have some vessels, we call them pelvic vessels, around our hips. So as the baby is getting bigger, rounder, the growing uterus begins to compress on these vessels. Normally, these vessels should drain fluid from our feet upward, but when they are compressed, they are narrowed. That's what causes the buildup of fluid in our lower bodies, and then we have swollen feet. So swollen feet is totally normal. Your pregnancy is progressing and everything is going on fine. So what do we do about it? How do we deal with it? First of all, give yourself a break. You find yourself somewhere, you find yourself at home, you're tired of standing and cooking. Just sit down and elevate your feet. It's very important. Give yourself a break, elevate your feet, raise your feet up. Another thing you can do is avoid long periods of standing or sitting. It's better to walk. If you take walks like 5 minutes, 10 minutes, randomly, occasionally, it would encourage circulation, and then the blood will flow from your feet upward. Another thing that would help swollen feet is you reduce salt intake. We all know salt attracts water. And so if you're taking a lot of sodium, a lot of salty food, and your feet are getting more swollen, it's advisable to cut down on salt. It's advisable to also cut down on caffeine, coffee. It's advisable to, if you take it thrice a day, you could just take it in the morning once to just reduce it. And then you're pregnant, wear loose, comfortable clothing, something you could easily move around with, not anything that will cause any discomfort to you. Another thing is you could wear compression stockings. What the stockings do is they compress the feet and encourage circulation upward. So compression stockings can work. When you want to lie down, when you want to sleep, you sleep on your left side. This would help circulation and reduce compression of any vessel. This is important because if swollen feet is injuring your normal day-to-day activities, injuring your functioning, or even your self-image, you don't like it, you could try all these methods so as to reduce it. Another thing, swollen feet can be abnormal, and I'll talk about a situation. For instance, your feet are swelling, your body is swelling, you're gaining weight, and you have probably a previous history of hypertension, of kidney disorder, and you've been going for antenatal. It's important to pay attention to your urine. Normally, when we go to clinic, they take our urine and do a urinalysis to check for protein in the urine, to check for sugar in the urine. If you are having protein in your urine, proteinuria, your blood pressure is high, you are more than 20 weeks pregnant, and then you have fluid buildup, this is usually a sign of preeclampsia. And it's usually a danger sign because preeclampsia can cause imminent eclampsia, which is like convulsion, and that could damage or cause a lot of harm. So it's important, if your feet are swollen, your body is swollen, you don't feel fine, your blood pressure is high, or you have previous history of preeclampsia, it's important to pay attention to the swollen feet. Another thing, swollen feet. Pregnancy is a risk factor for what we call deep venous thrombosis. Don't worry, don't bother about the term. Just let me tell you what it is. What DVT is, for short, is that your feet, they feel warm, they are painful, tender, you touch it and then you can elicit pain, they are warm, could be red, and then swollen. This could mean a clot has formed in your blood vessel and your feet are swollen. This situation is not normal, and this situation you should go and see your doctor if you think, oh, this swollen feet, I'm not comfortable, I have other symptoms or other problems. But besides that, enjoy the swollen feet. It's just for a few months anyway. Thank you.
Thank you very much. Please don't forget to